This is the fourth side event that NYU is organizing on the occasion of high-level meetings at the United Nations. So this week, the United Nations General Assembly is staging 3 high-level meetings related to health. It's the second time that universal health coverage is on the agenda. This is the occasion why we are organizing this side event here at NYU to bring attention to the issue and to make people aware that oral health care needs to be part of universal health coverage.
As a chief dental officer for Israel's Ministry of Health, we're responsible for the whole bunch of dental health activities. So for me, it was very important to take part in this conversation under the WHO roof to discuss on global oral health issues. We understand that the burden of oral diseases is unbearable. It's too huge today. And when you have this result at the end point, you understand that you should do something differently.
Oral diseases are highly prevalent conditions, much more so than most people understand, affecting over 3.5 billion people worldwide, and especially those who live in resource-poor or marginalized settings.
2.5 billion people with untreated tooth decay. And complete tooth loss affects 350 million people. Oral cancer, 380,000 people.
We have a significant difference in affordability challenges, financial barriers, whatever the word you want to use, for oral healthcare services compared to the rest of the healthcare system. People who go to the dentist or dental care provider and have to pay out of pocket, there is a correlation with impoverishment in the developing world.
If I simplify, we live in two worlds, in two parallel worlds. One part is the world that we know, that you and I may be knowing. We have a dentist or an oral health care provider that we go to regularly. We know where to find care, and we know how to pay for that care. And the other half of the world's population live in situations where there are not enough oral health professionals, or they have no coverage to pay for that care, or they need to travel long distances to get to the next clinic setting where they can receive care. The political economy of oral health care is built around this half of the world that can afford dental care. We have basically no system, no alternative way to address the other half of the world's population.
Within the Sustainable Development Goals, there are 2 particular targets that we're aiming to meet. One around providing comprehensive health services to all, leaving no one behind. And the second, to ensure financial protection for all, so that nobody falls into poverty as a result of catastrophic expenditures. We also need to be able to provide alternatives, healthy alternatives, and that is a problem, I think. You know, when we have sugar beverages that are cheaper than water in many grocery stores, that is an issue. Or our processed foods that often are much more cheaper than healthier options such as fruit and vegetables. That is a major problem.
We found out very early on that those countries that invested in community-based service, they had access to healthy products, healthy water, fluoride at the appropriate level was in their community water supply. That was doing more for prevention than personal care. We have to think more broadly than the personal care system. When we think of health systems, it's really larger than the personal care model.
You need to attack it at the local level and at the international level. You need the work of international agencies like the UN, like the WHO. You need the work of local governments, whether at the municipal level all the way to the nation state. Everybody needs to start singing from the same songbook. And when you start getting that, as we are seeing now, you start getting a lot of political will and a lot of movement.
At the moment, every country can look at their oral health profiles. They can look at what is the condition, what is needed, what is the gaps. So there is literally no excuse not to do, things to or actions to amend the situation.
Historically, almost all dental care in Israel, almost all services used to be provided by private market, except some oral and maxillofacial surgery treatments and dental care for some special patient groups. What we are trying to do, we try to increase the capacity of workforce dedicated to oral health issues, working together with public health nurses, pediatricians, and family physicians.
While we need more money for health, we also need more health for the money. This can be done by focusing much of our attention on primary care, by appropriately utilizing digital health services, and also through pooled procurement. If we can actually have pooled procurement of quality assured goods, particularly by the public sector, then we can cut out a lot of the intermediary costs. And this has been shown in some of the states in India that greatly the costs can be reduced of getting quality assured drugs and equipment.
I think we're at a crucial moment for the oral health movement. We have a lot of evidence now that we didn't have even 5 years ago, linking oral health with broader non-communicable diseases. We have a significant movement globally on universal health coverage. I think it's a great opportunity now in history to really reintegrate and reconnect mouth to body.
The important thing is that we get a process going. Whether we reach them or not is, for me, is secondary. Some of them are ambitious anyhow, but that's the nature of a goal and of a vision. You want something to strive towards. There are many areas where improvement is necessary and much needed, and where small and simple steps can already make a big difference. And it's important that we start with these small and simple ones that do not necessarily require big investments, just a matter of political commitment and goodwill and support. And if we see that small changes lead to bigger changes, lead to even bigger changes, it's this idea of incremental improvement. This is what I'm looking for.
It really starts with a community. You leverage, you identify your needs, think about what you have, leverage what you have, build alliances, and create a community. And as Margaret Mead is credited with saying, never doubt a small group of thoughtful, committed citizens can change the world, and indeed, that is the only thing that really has.
The information that is now being provided through the national profiles on oral health, through the global stress sheet, that really establishes the necessary linkages between access to services and improved health outcomes. And so if we can continue to make that argument to providers, to insurers, and most importantly to government, so that they can allocate the necessary funding, I think we can make a major step forward in improving oral health in the region of the Americas and globally.